Hi, my name is Dr. Rosbrook, and I'm the Director of the Limb Salvage and Amputation Reconstruction Center at Hospital for Special Surgery. I'm going to spend a few minutes with you today showing you a case of osseointegration amputation reconstruction surgery, and we'll focus on a particular patient, Randy, to help illustrate the details of this surgery and the immense advantages. Amputation reconstruction using osseointegration is an exciting new technology where the prosthesis is actually anchored into the bone, and that changes the whole way that amputation reconstruction is done. There's a direct skeletal connection between the prosthetic leg and the patient's bone. Well, it turns out that bone-anchored prosthesis had better outcomes and function than sockets in many studies, and despite the concern about infection, turns out that severe infections and implant loosening is actually quite rare. The advantages of osseointegration come down to that there are no socket issues. It allows you to get rid of the socket. Socket, as people who have sockets know, often lead to problems including pressure sores, poor fit, and pinching. And this is particularly true when the residual limb doesn't fit well into the socket. With osseointegration, there's improved control of the prosthetic leg with improved energy transfer via the direct skeletal connection. Patients report that there's improved proprioception, and this is all especially helpful with short and wide residual leg. Here's an example of Randy and the direct skeletal connection of the prosthetic leg. The blue arrow shows the implant in the femur. You've got a front view and a side view, and then you have an actual picture of the implant as well. The bone grows into the implant, hence the name osseointegration. The dual cone is illustrated by the red arrow on the front view, the side view, and the actual photograph of the implant. And that is the connection between the implant in the bone and the outside world that allows the prosthetic leg to get connected via an adapter. And in this particular picture, there's just a gauze wrap around the dual cone, which we usually use for the first few weeks after surgery to collect any minor drainage, but eventually that gets eliminated. This is a picture of Randy on the day that he got his leg connected, and we typically will use a loading protocol where we gradually increase the amount of weight and the duration of loading. We have a great team at Hospital for Special Surgery that are handling osseointegration amputation reconstruction, including dedicated physical therapists and prosthetic and orthotists. One of the main advantages of osseointegration is the improved energy transfer between the bone and the prosthetic leg, and that's illustrated in Randy doing some of these exercises. These were pictures taken just 2 weeks after the leg was connected. We've been collaborating with Dr. Almuderis from Osseointernational in Sydney, Australia, and in fact the implant that you see is an example of the Osseointernational implant. The process for making this implant is very precise. It starts with an X-ray. It's followed by a CT scan where the custom-made implant is sized to the patient's bone, and from that a very specific custom-made implant is created that fits directly into the patient bone. I want to thank you for your attention. I hope that this has been informative, and I've been pleased to share this exciting new technology of osseointegration amputation reconstruction surgery.